listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we are talking about the Medicare Prescription Payment Plan program. Get the information you need now so you can answer questions from your clients. What insurance agents need to know about the Medicare Prescription Payment Plan program, written by Emily Markovic. For Medicare Part D clients facing the burden of high out-of-pocket prescription drug costs, they might be able to find relief by using the Medicare Prescription Payment Plan program. Implemented in 2025, the Inflation Reduction Act's Medicare Prescription Payment Plan allows beneficiaries to pay Medicare Part D out-of-pocket costs over the course of the year. We're going over this program today so you can educate your clients and help them sign up. Before we get into the details of this specific program, let's talk about the legislation that created it. To briefly recap, in August 2022, President Biden signed the Inflation Reduction Act of 2022 into law. Part of this law provides financial relief for millions of Medicare beneficiaries by expanding benefits, lowering drug costs, keeping prescription drug premiums stable, and strengthening the Medicare program for the future. As a result of the legislation, in 2025, the Medicare Prescription Payment Plan requires all Medicare Part D prescription drug plans, both standalone PDP and Medicare Advantage prescription drug plans, to offer beneficiaries the option to pay for their prescription drugs in capped monthly payments. So, how can your clients opt into this program? Clients enrolling in Medicare Part D coverage can opt into the Medicare Prescription Payment Plan program. There are tools available to use, including monthly cost estimators, helping your clients and their families decide whether or not to participate in the program. Clients already enrolled in Part D coverage can also register for the payment plan program throughout the plan year. Part D enrollees can do so by contacting their Part D sponsor and completing the Medicare Prescription Payment Plan election process. Make sure you are familiar with this process so you'll be able to help your clients join the program. No matter if completed by paper, telephone, or online, Part D sponsors must consider all program election requests. Part D sponsors must also send the program election request forms either via the membership ID card mailing or in a separate mailing sent out during the same time frame, creating a simple opt-in opportunity for your clients. Additional details to make note of. First and foremost, it's important that your clients understand this program does not reduce the out-of-pocket cost amount they pay for their prescription drugs. Rather, it makes paying the amount more manageable by spreading the cost throughout the plan year. And then as far as turnaround time on enrollment in the program, Part D sponsors must process election requests within 10 calendar days prior to the plan year and within 24 hours during the plan year. Here's how the Medicare Prescription Payment Plan works. Beneficiaries who participate in the program will not pay upfront and in full at the pharmacy for their covered Part D prescription drugs when they pick up their prescription. Instead, their Part D plan sponsor will bill them monthly for any cost-sharing amount incurred. Part D plan sponsors must promptly reimburse pharmacies the cost-sharing amount that normally would have been paid by a beneficiary. If there is ever a time a beneficiary would like to opt out of the program, Part D sponsors cannot require them to pay a lump sum repayment of any cost sharing incurred. The sponsor must continue to send monthly bills until the balance is completely paid. However, it is possible for a beneficiary to pay off their remaining cost-sharing balance in one lump sum should they choose to do so. After opting out of the program, moving forward, the individual will pay any new out-of-pocket costs directly to the pharmacy. Let's move on to who qualifies for the Medicare prescription payment plan. This program is available to anyone with Medicare Part D, including those in the Extra Help program. Enrollees with high cost sharing earlier in the plan year, such as those paying for brand name and non-preferred drugs versus generic, will likely benefit the most from the program. During the plan year, Part D plan sponsors must perform targeted outreach to enrollees they identify as likely to benefit from the program. Additionally, Part D sponsors are responsible for notifying pharmacies at the point of sale if a Part D enrollee meets a $600 out-of-pocket threshold based on a single prescription. Upon receiving this notification, pharmacies should then provide information on the program to the beneficiary. And then last but not least, let's go over the education efforts around the Medicare prescription payment plan. According to CMS, Part D plan sponsors are required to include information about the program in current Part D communications materials, including their websites, member ID cards, or separate mailings and notices to enrollees. So, evidence of coverage, annual notice of change, and explanation of benefits documents. They also must include information on their websites regarding the low-income subsidy program, including information on the recent expansion of eligibility and how to enroll in the program. This should also help enhance beneficiary awareness of the program. CMS covers the Medicare prescription payment plan in the Medicare and You Handbook. Partners will be able to access resources and materials on Medicare.gov, including a cost preview feature in the Medicare Plan Finder and a fact sheet. We recommend that agents become familiar with this program, and we've included links to helpful resources and documents in the episode notes. Doing so will help you better understand the program and equip you to field a range of questions from your clients. This program is an exciting budgeting opportunity for Medicare beneficiaries that will hopefully relieve some stress from the financial insecurity many are facing. Thanks so much for taking the time to listen to this installment of our show. Be sure to check out the notes for the resources we mentioned and to follow along with our show if you're not already doing so. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Markovic, script proofing by Tina Lamoureux, recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.